Hello, hello, good evening. It is a special enrollment town hall getting you ready for enrollment over the right way. I'm Persian Nicole, the Power to P, a 92Q. Of course, you can hang out with me Monday through Friday, 10 a.m. to 3 p.m. And tonight, Maryland Health Connection is preparing you and protecting you from the unexpected to help us navigate. I have Tamara from Maryland Health Connection. Hey, Tamara.
Hey.
So excited to do this. Let's talk a little bit about your background. And for those who don't maybe know you, they get to know you a little bit.
Okay. I've been with state services, a public servant, for 30 years now. I started off in Department of Human Resources. Actually known as Department of Social Services. Moved up through the ranks and now met the famous Maryland Health Connection, the Maryland Health Benefit Exchange.
I love it. Come on, resume. Come on, resume.
Resume.
Okay. As we're having a conversation today, if you're on Facebook, or on YouTube, or 92q.com, wherever you're watching this at, you can ask a question. We'll pop up on the screen and we'll get Tamara to answer it for you. And if not, of course, we'll navigate you to where you need to go. Let's kick off the convo first talking about Maryland Health Connection and how it works. What exactly is Maryland Health Connection?
Well, Maryland Health Connection is the state's insurance marketplace. It's our one-stop and shop to browse, compare plans, find savings, of course, get covered. You know, accidents can happen. You never know when you might need emergency care, a doctor's visit, or a specialist. With health insurance, you're covered when the unexpected happens. Mm-hmm. You can visit marylandhealthconnection.gov to get covered. You can browse side-by-side plans and your savings, or you can download our mobile app, which is my favorite, Enroll MHC, and enroll right there.
And I like how you can do it the side-by-side too, because I think it becomes very confusing. We have all these different elements and we're like, okay, wait, let me go back over here. Exactly. Okay, wait, but what, you know what I mean? It's just a whole lot going on, right?
Yes, definitely.
Let's talk about, actually, is that just like the estimate tool? Is that similar to the estimate tool?
Yes. Well, estimate tool is something down a little down below. So estimate tool is when you can actually browse and get an estimate on how much it will cost. That's something a little bit different. But the MHC enrollment app, mobile app, you can enroll right from your cell phone. You know, we all use our cell phones these days, and you can enroll right from your cell phone.
If you can get on Instagram, Snapchat, Twitter, and TikTok, you can get on your phone and check out the open enrollment with Maryland Health Connection, okay?
Exactly.
Let's talk about the deadlines. It's always a due date for this. For those who don't know, what is a deadline for open enrollment?
Okay. Actually, you can enroll right now. Open enrollment to sign up for 2023 health plans runs right now through January the 15th, 2023. If you're curious, you can just jump on, shop. Like I said, use the estimate tool. Also, you can go ahead and just apply. Mm-hmm. If you want insurance by the new year, you have to enroll by December the 31st, 2022. If you enroll after that, you will get a start date of February the 1st, 2023. So that's very important.
So let's not be like, you know what, I got some days. Just do it right now as you're watching us. If you're on your phone or your laptop or whatever, get to the other device and try to get on them right now. Get on the app or whatever it might be, because as we can see, everything goes by fast. 2022 is a wrap at this point, you know?
Yeah, it is.
So definitely get on there and make sure you are part of the enrollment. Do not wait too long, because you want to make sure it all activates come January. You don't have to wait until February, because if something happens like the unexpected in January, you'll be covered.
Exactly. That's what we want.
That's what we want. Let's talk about the plans, because, you know, that's the most important part right there. What is covered?
So the Maryland Health Connection offer plans from insurance companies that you know, like Care First, Kaiser Permanente, United Healthcare. This year, no matter where you live in Maryland, you have a choice of multiple plans this year. Mm-hmm. Also, it's a one-stop and shop also to apply for Medicaid and Maryland Children's Health Insurance programs. So if you already have Medicaid or MCHIP, we call it, you're all set. But you have to check back to make sure your contact information is updated. We know with the pandemic, a lot of people moved and relocated to different areas of the town. So we want to make sure, we can locate you and you get your mail and things of that nature. So we'll be reaching out to all members at the new year.
I'm happy you brought up Medicaid really quick. How do you know if you're eligible for Medicaid?
All you have to do is go on and apply. So it depends on your income. Like if you're not working, apply. The income guidelines right now, due to ACA, has risen. So I'm sure that a lot of people probably don't know they're Medicaid eligible, and they are. So I would say just go online, just apply. 9 out of 10 people who go online and apply get a huge savings or even free medical insurance.
Well, I like free, and I like
free too.
So that works for me, hands down.
With the cost of eggs and gas and bread, light bill.
Tamara, don't get me started on that, because I have to go to the grocery store when we're done with this, and I'm going to buy 3 things. I'm going to pay $80. So I need all the savings I can get.
Exactly.
What should you consider when choosing these plans? Because there is lots of options. And, how do you weigh things and say, okay, this works better for me here, this works better for me here? How do we know?
I will always tell individuals, think about your budget, but also think about your health needs, right? We have certain metal level plans, but always choose one that fits your needs. We have brokers, licensed insurance brokers, who can help you. They will, you will tell them what your needs are. They will tell you, what's best for you, and definitely fit one in your budget, one you're going to be able to afford. But with the tax subsidies, to many of our Marylanders, it's going to be a lot of help.
Yeah, we definitely need that. I want to remind you, as you are just maybe tuning in on the conversation, you can ask any questions that you want. I'm here with Tamara from Maryland Health Connection. She is our expert of the night, so she's going to be able to answer any questions you have. Open enrollment is here, but you have to make sure you get it done before the top of the year. When's the date? December 31st?
December the 31st, if you want coverage by January the 1st. And if you enroll after January the 1st, you want to make sure you enroll by January the 15th to get coverage for February the 1st.
So let's say it is January the 16th. Now what happens then? Because at this point,
January the 16th, you cannot enroll into a private health plan unless you have a SEP, special enrollment. So if you lose your job, get married, move to Maryland, then of course you can get health coverage. We can fit you in. But if you enroll after the 15th and you don't have a SEP, you will not be able to get a private health plan unless you have the SEP, except for if you're Medicaid eligible, which is all year long enrollment. There's no end date with Medicaid.
Okay. So that's good to know too, because some people might be like, oh my God, it's the 16th. What do I do now? At this point, nothing. At this point, open your wallet. You know what I mean?
Yeah.
Also when it comes to enrollments, when you're choosing your different plans, you'll see a low, a medium, a high. How do you know then what you need? How do you know if you need a low, a medium, or a high?
Well, it's always that unexpected, right?
Right.
So I would, right now we have silver plans and gold plans that's going for the same amount as the bronze plans.
Okay.
So, and that's the lower plans. So I would say, make sure you get a plan you can afford, but make sure it's a plan that fits your medical and your health needs. That's very, very important. If you know you're going to have a high deductible, that's something to think about. If you want a zero deductible, that's something to think about. Just make sure you get something that fits your needs, your lifestyle, and your pockets. It's very important.
Yeah, because even if you get a low plan, that means you might be paying higher towards the end. So then that's kind of messing up your pockets as well. So for me, I had a low plan when it came to, I want to say vision. It was low, but vision, that's not expensive at all, really. So I had low. I don't know why I had low. I think when I originally enrolled, I was like, okay, give me low. But I didn't have programs and events like this to prepare me for the times of when I came to select my enrollment.
Okay.
So, like you said, it really depends on your pockets. But now I'm at the high because I'm like, I don't want to have to pay on the
I
other
want
side.
everything covered.
I need it all covered, okay? Because stuff is expensive as we blink our eyes. Things get
Yes,
more and more
yes,
expensive.
yes.
Let's talk about enrollments. When we go to Maryland Health Connection on the app or online, whatever it might be on the website, how do we start off enrollment?
So you just go on there, you push to apply, and you just start your enrollment. What do you need in order to enroll? So everybody needs their photo ID, social security card, immigration, citizenship documents for some residents. You're going to need your pay stubs or W 2 or your tax statement if you are employed. And you're also going to need policy numbers for any other health insurance you may have.
Okay, and for those who are just tuning in, I know we talked about the tool earlier, but let's talk about some other resources that you can find on the Maryland Health Connection website to walk us through enrollment.
So the tools you can do, again, you can browse plans, and that will give you an opportunity to browse side by side view to see what's best for you. You can also use your mobile app. Again, the mobile app is wonderful. You can enroll in coverage through your phone, and everybody know how to use the phone these days, right? So it's no excuses, you guys. Come on, use your phones, get enrolled. It's very, very important because you want to be protected from the unexpected.
I love that's a hashtag right there, honey. I'm about to put it on my next photo, okay? You know, when it comes to enrollment, there's so many different things we have to walk through every single day. And that's why really we had this event to prepare you and of course protect you from the unexpected with Maryland Health Connection. And I'm so excited, Tamara, we had this time to talk about this today because a lot of people don't know still about enrollment. And let's say someone is just getting out of college, they got their first job, or listen, you could have been working for 20 years and you still don't realize when it comes to enrollment what exactly to do. So these are some great questions that we're getting answered. Michael Davis, can a person get it if their job is a Lyft or Uber type of job? Which is a really great question because people might not know. Let's talk
Right.
about that.
So I think most Uber jobs, you're actually self-employed, basically. Even though you're going through Uber, you're self-employed. So yes, you definitely will be able to apply. If your job offers health coverage, you have to make sure it's affordable, the affordability test. So we have that. Again, we have trained experts in the community that will help you. You can call on the phone. You can go in person. You can work with someone over your tablet or your laptop over your phone. There's no reason why you can't get insurance because we will help you get insurance. We have that connection to the community that will help you get enrolled.
Yeah, and you know, like at this point, it's so many different options. It's like no excuse not to even know what's going on. You know what I mean?
Definitely.
Let's take it back to the different plans and go over that one more time for people who are just tuning in, talking about the plans of Maryland Health Connection, because people might not know, like you said earlier, you're linked to so many different companies that we're very familiar with. Let's talk about those companies to see if people, know what they can be getting.
Sure. Again, there's Care First, there's Kaiser Permanente, and there's United Healthcare. So all three of those plans, and they're offered throughout the state of Maryland. We also have Medicaid and Maryland Children's Health Insurance programs. So all of those are offered through the Maryland Health Connection. Also, I want to say Maryland Health Connection is the only place you can get tax subsidies to help you be able to afford your premium. Just to let you know, the average consumer saves over $300 a month. That's a lot of money.
Yeah.
You can save or you can spend it on like things like food and gas, right?
Mm-hmm.
So it's really important.
Yeah, let's talk about some myths, maybe some things that you've heard about enrollment that you're like, you know what, that's just not true. And this is really the facts about it. What are some things that you've heard that is absolutely not true about enrollment, just from conversations?
I want to say if you're young, you don't need insurance.
Mm-hmm.
Nothing's going to happen to you. You're good.
Mm-hmm.
But then, God forbid, you go out there and get into that car accident or something happens, you right? And then you need insurance. I think sometimes I hear the younger population say, "Hey, we don't need to get insurance. We're healthy."
Mm-hmm.
You always have to have health insurance. You just never know. You can get a cold, and during the pandemic, we really realized that not having health insurance was definitely an issue, right?
Mm-hmm.
So yeah, that's one of the famous myths. I'm young. I don't need health insurance. But you did.
Yeah, because we saw during the pandemic, young people was also getting COVID, and they were going and trying to go to the hospital, and they were trying to get some type of help, but they didn't have any coverage. And to get the COVID shot, a lot of people were taking insurance to pay for the COVID shots. People were doing it for free, but I saw a lot of different companies like, oh, you had to have insurance to do this, so we're not taking insurance, whatever it might be. But you had to pay out of pocket then.
And you wasn't supposed to now. You wasn't supposed to. The COVID shot was supposed to be free to everybody.
Supposed to be.
Regardless if you had insurance or not.
Right. Well, it was supposed to be, but we didn't see a lot of things, right? As we're kind of wrapping this up, I want to make sure we get more questions answered. If you do have one, we'll pop it up on the screen and make sure we get an answer by Tamara from Maryland Health Connection. I want to bring it back though, because we do still have more time to just talk about some things we talked about in the beginning again. But Maryland Health Connection is, how can they enroll? And when they're about to enroll, what steps and things they need to enroll? Let's cover that again.
Okay, so again, the Maryland Health Connection is the state's marketplace where a one-stop shop where you can browse plans, find savings, and get covered. The Maryland Health Connection is the only place you can get tax subsidies to help you be able to afford your monthly premium. Mm-hmm. Okay, so you can always visit the MarylandHealthConnection.gov, or you can use one of my favorites again, the mobile app. You can use your phone, get enrolled right there from your mobile app. Also, just go over the plans one more time. There's CareFirst, there's Kaiser Permanente, and United Healthcare. The Maryland Health Connection also is the place you go through to get Medicaid or Maryland Children's Insurance Plan.
And to make sure if you're eligible for Medicaid or not, again, you can just log on the website. And what's the worst that can happen? Them say, no, you're not eligible, but at least you tried to see if you were or not, right?
Yes. Look, let me tell you something. We have people that will be able to talk with you, to walk you through the process. Again, 9 out of 10 people get some type of savings getting their insurance through the Maryland Health Connection. That's a good ratio.
Yeah, that was huge. Like 1% more at this point, like that's mostly all of us, right? And like we talked about earlier, eggs are expensive, honey. So we're trying to save some money as we get into 2023. We wasted enough money. Let's start saving. Let's start building our future. Let's start making sure our kids are healthy, because no insurance is just, it doesn't make any sense for our families as we're continuing to grow, right?
Exactly. And also, I want to let you guys know that we have a call center, and we have support for over 200 languages.
Okay.
So including Relay for the Deaf and Hard of Hearing. Mm-hmm. So I just want to tell you, like, you call 1-855-642-8572. Someone would help you. Again, 200 languages. So whatever language you speak, we would be able to help you.
Okay, let's see. Keyshawn says, what if I didn't qualify at first because of my income, but now I've lost my job and need some type of insurance? Let's talk about that.
Let's come back. Come on, let's come back. Mm-hmm. Reapply. Your situation has changed. Reapply at MarylandHealthConnection.gov, or again, go on your phone and just download the app. The app is free, and download the app and apply. If you need assistance and you want to talk to someone, sometimes we have people that just need that personal assistance, right? We got you. We got you covered. The assistance is free. No one should be charging you to assist you. We have local community advocates. We have navigators. We have the call center, and we have brokers, which is licensed insurance authorized brokers. They will help you get enrolled. But if you lost your job, most likely you're going to be Medicaid eligible.
Okay.
Just apply.
Keyshawn said, I got something else. Another one. Also, is it possible to sign up my family under me?
Repeat that one more time.
After he's lost his job, it says, is it possible to sign up my family underneath me?
Yes. Your family, like your kids?
I'm assuming maybe he means kids. Let's give him the scenario, a broad one. Let's give him maybe kids.
Scenario. So adult who have say a husband, wife with 3 kids, of course, all of them can sign up. Let's say adult with 3 kids, yes, they can sign up. If you have, if it's you in the house and then your mom in the house, she would have her own account. You would have your own account. Both of you would apply.
But there's no age requirements to it?
No, just come on and apply. No.
She like, at this point,
just come
get
on.
it.
Come on.
Just come on in.
Just come on in and apply. MarylandHealthConnection.gov. We got you. Trust me, we got you.
All right, so make sure you head over to MarylandHealthConnection.gov, download the app, do anything you need to do to make sure that you are protected from the unexpected as we are in open enrollment. The deadline, December the 31st. If you do not make it by then, if you don't do it by January 15th as well, you're not enrolled by then, you have to wait till February, correct?
So no, let me go back. So if you enroll, so to get coverage for January the 1st, you have to enroll by December the 31st, 2022. Right. Okay. If you enroll in January, you will get coverage effective February the 1st, 2023. After January the 15th, you have to have a special enrollment, a special situation to come back in for a private health plan. But Medicaid is all year long.
Okay. So pretty much what she's saying is you're going to have to get a divorce, get remarried in order to get, some coverage again. Okay. And we don't want that.
No, we don't.
Tamara, thank you so much again. For anything, you can enroll and log on to MarylandHealthConnection.gov for any questions. And we want to make sure that you are protected from the unexpected. If you have more questions, of course, you can call the number. What's the number, Tamara?
1-855-642-8572.
Okay. All right. We appreciate you so much, Tamara. Thank you so much. Everybody have an amazing night. Stay protected and stay safe. And I will talk to you soon.
Thank you.